Hi, Randy. You are a well-respected and well-known palliative care leader. You've advanced the field through your extensive research. You've influenced the way care is delivered by mentoring other clinicians and educating them. And you've personally impacted the lives of many patients and families through your own clinical practice. Recently, you have been diagnosed with a serious illness. Please tell us about your ALS diagnosis and how it has impacted your life, your work, and your perspective on palliative care.
Thank you, Peggy. I was diagnosed with bulbar onset ALS in March of this year. And the way it's affected me most prominently is with my speech and also my swallow. For someone who likes to talk and talks for a living, in part, this has had a big impact on me. The other thing that's had a big impact on me is understanding the median survival, average survival, being about 2 to 4 years. Now, I also understand and hope that I may be on the tail of that, but it certainly changed my perspective on how I want to spend my time. And really brought into laser focus for me, working to, with the time that I have at work, working to really set the Cambia Health Center of Excellence up for the future and supporting my mentees.
I'd love to ask you more about your life's work, how you became interested in palliative care and why you founded the Cambia Palliative Care Center of Excellence.
I was a medical student in Baltimore at Johns Hopkins in the late 80s. And during my time there, the only training I got in anything that looks like palliative care or end of life care was a 20-minute movie they showed us. That was it. They didn't have someone come and talk to us about it. And during my clinical years there, HIV was just hitting that city. And we were taking care of a lot of young men, primarily, who were dying. And I remember feeling like occasionally we would provide really good care for a patient and their family, but much more commonly, it was really quite awful. I remember thinking, I know this can be done well. I've seen it done well. We need to find a way to make sure we do it well for everyone who's facing serious illness.
One of the things I think of palliative care is really about treating the whole person and taking a team approach. And
Yeah.
I think about how much that makes a difference in people's lives when you're looking at them holistically and not just treating body parts.
Yeah, I think that's really true. And one of the things I've experienced now receiving palliative care is the realization of how important it is to me that the people taking care of me know who I am as a person, and care about me as a person. You know, we've been teaching that in palliative care for 20 years, but when you're on the other side, it just amazes me how important that is to me.
Knowing you, I know how important your wife and your daughter are to you. And
Yeah.
I'm sure that your care team is including them in your treatment plan.
Oh, absolutely. And my wife comes with me to all my appointments, and not including her is not an option that she will allow. But they have been very embracing of that, of her, and that helps me a lot too. Because for me, making sure that the decisions we make are decisions about how the care I want and the approach I want to take factors in very heavily both my wife and my daughter.
Tell us about mentorship. Why is it important to you? And what does it mean to be a good mentor?
My own career was greatly impacted by an amazing mentor, uh, Len Hudson, who was head of our pulmonary critical care here at the university. He didn't do palliative care per se, but he believed in me and he supported me in what I wanted to do. And really enabled me to have the career I've had. Being a good mentor means being a good listener, listening to people, what's important to them, what they want, and even helping them to figure out what's important to them and what they want before they've really zeroed in on that. I feel like that's what good palliative care clinicians do. And I feel like that's what good mentors do as well.
To have someone you respect and admire say, I believe in you, that I think that's motivation for people.
Absolutely. I think that's really important, Becky.
As a person now living with serious illness, what are you worried about for the future with regards to your illness? And what are you hoping for?
I worry about the progression of my illness and losing function. I worry about losing my voice, being able to participate in, especially in my family life with the people I love. And honestly, I worry about becoming a burden on them as well as this illness progresses. And I think for me, having the opportunity to talk about that with palliative care and my wife and daughter has been really helpful and will be even more helpful as as this illness progresses.
That's a heavy worry, I think.
I'm hopeful that I can continue to find the joy that I do in my family, my time with my wife and daughter and friends, and also in my work. I love thinking about what we can do and how we can implement programs that improve care. I get excited about it. So I'm hopeful that I can continue to find opportunities for joy and quality time.
Now, I know that many people have reached out to you since your diagnosis. What has that experience been like for you?
It's wonderful. I certainly have felt a lot of love and affection from people around the country, around the world, and it's wonderful. But I will say it's also very sad. After every one of these wonderful moments, I find it takes me a while to recover.
Hearing that response, I want to thank you even more for sharing your heart with us and sharing your experience. I know it takes a lot, and I appreciate that your willingness to share your experience with this audience. anything you'd like to share with this community?
One of the things that no one's asked me about until you, Peggy, is my family. And as you mentioned, they're so important to me. And I appreciate you mentioning them. The other thing I haven't really talked about is my thoughts about my legacy. And I think when I was younger, I thought my legacy would be based on how many papers I published or grants I gotten or money I'd raised. But now, for me, I see my legacy very different. I see my legacy as people. The people that I have mentored, the people I've worked with and touched in some way. It's much more fulfilling for me to focus on that as being my legacy.
Your influence on me and on our foundation has been profound. And so, I like to think the Cambia Health Foundation is part of your legacy. Certainly, the Cambia Palliative Care Center of Excellence is your legacy and all the people that have come through there. And then all of the people that you have mentored. And I think we both know that community will continue to grow, and there'll be ripples from the people that you've influenced and mentored, that hopefully, like you, they'll go pay it forward and influence and mentor others. So that's a great vision for your legacy.
Yeah, thank you. That means a lot to me to hear you say that. Thanks, Peggy. I appreciate it.
Take care.
All right, you too.